I'm Tony Rayburn. I'm with FSCJ, the nursing program, in second term, and I am going to demonstrate the preparation and administration of a Minibag. I've come to my med room. I have my MAR for my client. I'm going to administer vancomycin today to this client. The action of this antibiotic is it binds the cells, binds the bacterial cells to cause cell death. It's used to treat potentially life-threatening infections, which, when less toxic, antibacterials aren't effective. Usual dosage is around 500 milligrams per 6 hours for an adult. Side effects are ototoxicity, hypertension, Redman syndrome, which occurs when you infuse the drug too fast. Contradictions are hypersensitivity to the drug and renal impairment, which, if applicable, you can slow the infusion. Some nursing implications: when we get to the client, we'll assess vital signs, monitor blood pressure, check the site for infiltration and phlebitis, things like that. But we'll get ready here. My MAR calls for 200 milligrams of vancomycin administered over 2 hours. We will be using a Minibag, which is a 50 milliliter sterile normal saline solution that we'll inject the other vancomycin into. It's available in 100 milligrams per milliliter, so we need 200 milligrams, so we will be taking 2 milliliters of vancomycin today. Then we will instill it into the Minibag. And then we will go with that to see that it needs to go over 2 hours, so we will use dimensional analysis to know you have 50 milliliters over 2 hours at 10 drops a minute, times the rate of 1 hour over 60 minutes, will approximately 4 drops per minute. So we will get started here. I've washed my hands. I've gathered the materials that are necessary. I wash the hands. We will clean our vial here, all the prep sites that we will have to inject into to sterilize. We have a cylinder with a sterile needle, has not been used. Draw the 2 milliliters that we need to instill into air into the vial. Remove the cap, insert. We will inject the air, and we will draw back the 2 milliliters of solution that we need. Pull past, remove any air that's in there. Alright. So now we will go straight into the Minibag, so not worry about any counterindications. Alright, the drug has been administered into the Minibag. We will cap, and we will remove that into the sharp spin. Alright, so next I will take my tubing and I will prime this bag. I will remove the cap and insert. I'll make sure some comes into the cylinder so we can actually get some drops going to actually prime. We will loosen the connection. So we got drippage, we have drippage, so therefore the cylinder has been primed. Alright, at this point I will add a label to the Minibag to verify the patient, the dosage, the amount, and the time and date at which we're going to start this Minibag. Alright, I've grabbed myself a normal saline flush to take to the patient's room. We've taken everything away. All trash has been put away. I will go to the patient's room now. Hello, Mr. Jones. How are you doing today? Alright, can I get your time? Can I get your name and date real fast from you? Alright. Date and name are same as shown and on the MAR. Alright. So I'm going to wash my hands again, and I will apply clean gloves, not sterile gloves. Alright, how you doing today, Mr. Jones? I'm going to be administering your Vanco today. Have you had that before? Well, it's a pretty potent antibiotic to treat the infection that you have. As I'm talking, I'll check the site, see that it doesn't appear any infiltration, no phlebitis, no tenderness. Any pain here, sir? No, nothing more than having something in your arm as it is. So the site looks good. I will prepare an alcohol swab here to cleanse the end of the. So I have my flush here. I will connect my flush. I will open the pigtail. I will pull back. I see blood return. So I will start to administer the flush at the push stop method of 0.5 milliliter per push. Alright. 3 milliliters of saline have been flushed through. Alright. So next we'll have our Minibag application. Cap is removed. Inserted. Now I'll open up the route here until I get an appropriate drop factor of the 4 drops we were heading for.
Okay, so this is already been used, correct?
Alright, so is there any pain? Feel anything different right now? No? Alright, well this is gonna run for 2 hours, so I'll be back just under 2 hours to check on you. So I will return your personal belongings. Do you need to use the restroom before I go? No, because we don't really want you moving around too much with an IV in you. So you don't go to the bathroom. Any pain other than, anything going? No? Okay. Personal belongings, you don't have to use the restroom. Is your position good? You want to be tilted a little higher up, a little lower down? No, you're good? Alright, well I'll be back to check on you in a few. Alright, so then I will leave the room, remove my gloves, take everything that I brought into the room, the swabs, the saline, everything to remove and throw in their appropriate container. I will come back just under 2 hours because we don't want the bag to totally empty itself. I will reassess the client. I will check the area. Everything looks good. I don't see any inflammation. Nope. Is there any pain like before? No. Can I get you to just recheck your name for you? Yeah, I know. You're the same person I saw earlier. Alright. So name and everything matches the MAR as before. I will reapply gloves.
What is your patient?
I'll try to talk to the patient while he's doing this to make sure he knows what's going on with the situation, that his drug treating the infection, things like that again, in case he wasn't sure before. I'll come in. I have another flush that I uncap. I make sure I stop any potential infusion. I remove. I have another alcohol swab that I will clean just in case. Apply. And then I will check for return. Yes, we have a patent vein still, which is good to make sure we didn't infuse any into the interstitial tissue. I will push stop as before, 3 milliliters. At that point, I will lock pigtail, remove the vial, ask how they're doing, if they're in any pain, if they have to use the restroom now, if they want any of their personal belongings a little closer to their position, the pain level as before. And if nothing, they don't need anything, I will then make sure I finish all my documentation of what was infused, the time, the date, the dose, the route, the site, and how the patient reacted to the application. And